I'm Rebecca Marmore. I'm a Johns Hopkins vascular surgeon. I practice out of Howard County General Hospital. When we think about dialysis access, there are three basic ways we're able to obtain it. The first is called a fistula, and that's really our preferred way of getting dialysis access for our patients because it incurs the lowest risk of infection and typically lasts the very longest. However, not all patients are candidates for fistulas. If your arteries or your veins are too small, we may have to perform what's called a graft procedure. And in an arteriovenous graft, we insert a small plastic tube underneath your skin and connect it to your artery and vein. This is used for your dialysis access. The last option for getting dialysis access is what's called a tunneled dialysis catheter. This is the least preferable because it incurs the highest risk of infection, and we typically only use it in select circumstances. For example, in patients who need urgent dialysis and we didn't know that that was going to happen to them. In that procedure, we insert a plastic tube underneath their collarbone. Again, it's usually temporary and we use it as a bridge to getting them either a fistula or a graft. So on the day of surgery, you'll come to our pre-op area where I'll see you and we'll talk about all your last-minute questions and sign your consent paperwork. Almost all of these procedures are done with minimal sedation and local anesthetic at the site of where we'll do your surgery. Sometimes, if the patient wants to and they're safe, we can put them to sleep if that's their preference. Surgery usually takes somewhere between an hour and 2 hours, depending on exactly what we're doing. After that, we take you to the recovery room where you wake up, you'll have some juice and cookies, and if everything's going well, you'll be home later on in the day. Even though fistulas are a preferred method for obtaining dialysis access for our patients, they do have the disadvantage of actually taking the longest to be able to be used for access. So from the time we actually create the connection, the day of surgery, between your artery and your vein, the earliest we can usually use a fistula is about 6 weeks following that initial operation. However, depending on the type of fistula you may have, this can even take longer if you need a second stage operation to get the fistula ready for usage. A graft has the benefit of being able to be used a little bit sooner. So typically grafts are ready for cannulation or use in about 2 to 4 weeks after the initial surgery. Finally, tunneled catheters, although least preferable in terms of infection risk, do offer the benefit of being able to be used instantly after surgery. So I always tell all of my patients who are having any type of dialysis access surgery, it's a little bit like buying a fixer-upper house. You're gonna have to put work into it to keep it going. Think about it. It's a vein that's going to have needles stuck in it 3 times a week. And over time, the veins scar down. Sometimes the veins get black and blue marks, hematomas, and many times over the course of their life, they will need additional procedures, whether that's an open surgery or something called a fistulogram, which is a procedure where we're able to open up blockages in your fistula in a minimally invasive technique.